So in this video I'm going to show or demonstrate using Graston technique to treat the posterior rotator cuff, specifically infraspinatus, and then Teres minor coming from the inferior angle of the scapula and up into the backside of the rotator cuff here. In the article I posted earlier we talked about the trigger points and the referral patterns, and the big one in the infraspinatus is just sitting just below the spine of the scapula right in here. And now sometimes that can refer pain all the way through to the front of the shoulder and oftentimes down the arm as well. Versus Teres minor, a lot of times can refer pain to the lateral shoulder. So just a basic treatment using Graston technique. I'm going to take your arm across. Okay, bring your shoulder down a little bit. So a lot of times I'll just put them on a little bit of stretch. And with a larger instrument like GT4, I'll come in and do some sweeping through the posterior deltoid and then through the posterior part of that rotator cuff. Okay, kind of marking the bony prominences with my fingers, not to bump into the bone. Okay, so a lot of times starting out with lighter kind of sweeps and fans just to work through there gently. And then if I wanted to focus on a trigger point in particular, I'm going to bracket off that spot, use something smaller like GT3, and start out doing a little bit of sweeping through in multiple directions to treat that out. They may get a little bit of referral during the treatment, which is okay as long as it's nothing, nothing too sore. Okay? And eventually, as things calm down, I might get in a little more, bring the angle up, and do a little more strumming. Again, kind of working in multiple directions, so I'm hitting all of that trigger point. So infraspinatus a little higher, Teres minor coming off that inferior angle, so sometimes you're going to find that one down in here. Okay, again, bracket it so it's not just skin moving. And then I'm going to treat that out. And if I wanted to do some treatment with movement, let's bring your arm out to the side. Okay, so we can start in a shortened position. Go ahead and externally rotate as well. So then when you come across, you're just going to internally rotate as you go. Okay, so again, I could use a larger instrument in this case, and with Graston I turn the instrument upside down and catch it just nice and slow, and then I just pin as she moves. Okay, come on back out. Okay. I can pin, maybe even add a little bit of a fan to it as she goes. Doing okay?
Yep.
Or a little more aggressive way, again, I could take something smaller like GT3, get right on the trigger point that I want to treat, and then have her go through that motion again. So I'm just kind of pinning that trigger point as she goes. And much like you would do with ART or any kind of manual pin and stretch with your thumb, it's the same idea. Taking her through full range of motion and doing that treatment, or doing that pin and stretch. Okay, relax. So that's how I would use Graston technique to specifically treat those two muscles plus the trigger points. Again, you can use any number of manual techniques or even dry needling as well.